Today, we will discuss pneumonia, but really quickly. Are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Pneumonia is an infection that causes inflammation in the air sacs of the lungs. These air sacs can fill with fluid or pus, making it hard to breathe. In simple terms, it's like having a bad cold or flu, but much more serious because it affects your lungs directly. Common symptoms of pneumonia: cough, often with phlegm or mucus. Fever, a high temperature is common. Feeling very cold and shaking. Shortness of breath, difficulty breathing, especially when moving around. Chest pain, pain or discomfort when breathing or coughing. Fatigue, feeling very tired or weak. How to know if you have pneumonia. If you experience a combination of these symptoms, especially after having a cold or flu, it's important to see a doctor. They may perform a physical exam, listen to your lungs, and possibly order a chest X-ray or other tests to confirm pneumonia. If you suspect you have pneumonia or are experiencing severe symptoms, seek medical attention promptly. If someone has pneumonia, here are simple steps to follow. 1. See a doctor. It's important to get medical help. 2. Take medicine. Follow the doctor's advice on antibiotics or other medications. 3. Rest. Make sure to get plenty of rest to help the body heal. 4. Stay hydrated. Drink plenty of water and fluids. 5. Use a humidifier. This can help make breathing easier. 6. Follow up. Keep in touch with the doctor to monitor recovery. If symptoms get worse or if there are difficulties breathing, seek emergency help right away. In the hospital, here's what they typically do to help someone with pneumonia. 1. Oxygen support. They may give oxygen to help the person breathe better. 2. For fluids. They provide fluids through an IV to keep the person hydrated. 3. Medications. They administer antibiotics to fight the infection and other medicines to relieve symptoms. 4. Monitoring. Staff will keep a close eye on vital signs like heart rate and temperature. 5. Breathing treatments. They may use machines or inhalers to help with breathing. 6. Rest and care. Patients are encouraged to rest and receive care from nurses and doctors. These steps help the body recover from pneumonia and ensure the person is safe. Here are some commonly used medications for pneumonia. 1. Antibiotics for bacterial pneumonia. Amoxicillin, often used for mild cases. Azithromycin, commonly used, especially for patients with allergies to penicillin. Levofloxacin, a broader spectrum antibiotic for more severe cases. 2 antiviral medications for viral pneumonia. Oseltamivir Tamiflu, used for influenza-related pneumonia. Acyclovir, for pneumonia caused by certain viruses like herpes. 3 corticosteroids. Prednisone, sometimes used to reduce inflammation in severe cases. 4 bronchodilators. Albuterol helps open airways and make breathing easier. Always consult a healthcare professional for the appropriate medication based on the specific type of pneumonia and individual patient needs. Some people are more likely to get pneumonia, including 1. Older adults. People over 65 have weaker immune systems. 2. Young children. Babies and young kids are still building their immune systems. 3. Smoking. Smokers' lungs can be damaged, making it easier for infections to take hold. 4. Chronic illnesses. Those with conditions like asthma, diabetes, or heart disease are at higher risk. 5. Weakened immune system. People with conditions that weaken their immune system, like HIV/AIDS or those on chemotherapy, are more vulnerable. 6. Recent illness. If someone has had a cold or flu recently, they might be more susceptible. These factors can make it easier for pneumonia to develop. Now you need to watch my video on bronchiolitis or have a look at metabolic acidosis.